Hidden Stories of York Region is a Made in York Region podcast series aimed at disrupting the dominant narratives by sharing stories about lived realities, community issues, and innovative solutions across the region. Each episode features guest speakers living and/or working in York Region. Our conversations tackle challenging community issues and identify solutions and actions for change. My name is Janine Barrage-Paul, and I will be your host for episode 2 of Hidden Stories of York Region, Infrastructure for Community Care. Affordable and accessible housing is a basic human right, and it's essential to the infrastructure and health of our communities. The needs and challenges are so great that we are devoting all 4 of our episodes of season 3 to the housing challenges in York Region. Hidden Stories of York Region acknowledges that our work takes place on the traditional lands of the Anishinaabe, the Haudenosaunee, and Huron-Wendat. We acknowledge that we work and play on the ancestral lands of all Indigenous peoples who have left their knowledge before us. We acknowledge those who walk the lands now and future generations to come. Hidden Stories is committed to sharing the truths, realities, and knowledge of Indigenous communities in York Region. Alternatives to institutional housing for older adults and individuals with disabilities has been a general trend in Scandinavian countries for over 2 decades, with residential care provided in special housing in various forms. Research does show that age-friendly and needs-based housing creates physical and social environments that support independent and active living. As our community ages, alternatives to institutional care allow people to contribute to community life, as well as being a less costly housing option. To discuss and touch on some of these issues today, we have Kathleen Mochnacki from Home on the Hill Supportive Housing and Surjit Sachdev from Anand Vihar Intentional Living Consortium. Welcome to both of you.
Thank you.
Thank you.
Kathleen Mochnacki is co-founder and past president of Home on the Hill Supportive Housing. She has worked tirelessly engaging all levels of government about the plight of families who are left to support family members with serious mental illness in an environment where services are inadequate. During her tenure, Home on the Hill was able to secure stable housing for severely mentally ill clients in the community, giving them the opportunity to live their life with dignity and purpose. Kathy has lobbied incessantly that families have a voice in the development of services and for adequate support for people with serious mental illness and their caregivers. In December 2021, Kathy was awarded the Outstanding Canadian Award and Letter of Recognition for her community work for people and their families affected by serious mental illness. Recently, she was appointed to the Implementation Committee of the Affordable Housing Strategy of the City of Richmond Hill to represent supportive housing providers. Kathy continues to serve Home on the Hill as a board director and community liaison. Surjit Sachdev is the president of Anand Vihar, the Center for Dignified Living, a registered charity. Surjit, along with his board of directors, aims to construct and manage a residence for the vulnerable in the community, mainly low-wage earning seniors, individuals with disabilities, their caregivers, and women and children fleeing domestic violence. He is actively engaged with the municipality of Markham to be gifted 1.5 acres of land, so he may apply for capital funds to construct a purpose-built affordable rental residence under the National Housing Strategy. Surjit is a professional engineer who has worked in the steel and oil industry, is semi-retired now, and has a practice in financial planning. He has a Bachelor's of Science in Production Engineering from Punjab, India, and a Master's of Engineering degree in Industrial Engineering from the University of Toronto, Ontario. So before getting into some deeper questions today related to your respective work areas, as a starting point, I really thought it would be great to hear from both of you what the ideal situation would look like when it comes to supportive housing for vulnerable populations in York Region. It would be great, Surjit, if you could start us off with that question.
Well, the ideal situation, Janine, is really the core point of providing land, because not-for-profit agencies are waiting for this item because land has become so expensive, so prohibitively expensive, that for us to construct anything or to apply for funds, this is the first starting point, and that is what we want to start off with.
Thanks, Surjit. And how about you, Kathy?
Well, when I think of supportive housing, I think of community. And I really would like a change of looking at the whole concept of supportive housing. It's really interesting. I actually met with people from the Richmond Hill Board of Trade, and they, of course, are very interested in bringing people here to Richmond Hill so that they have staff for their various businesses. But these people come often with vulnerable people. And I think that if we start to look at addressing the needs of vulnerable people, as one of the members of the Board of Trade said, by helping you at Home on the Hill, we're helping ourselves.
So Kathy, maybe we could just jump into your work at Home on the Hill. It's really been so transformative, and you co-founded it from the lived experience of seeking supportive housing for your own family member. What are the challenges families who need this type of housing face?
Well, first of all, there's very little in terms of supportive housing in our community, and that was a major reason why Home on the Hill started so many years ago. Secondly, the housing that is available for our loved ones is custodial housing. And my son actually lived in one of these buildings in Newmarket. And he shared the house with 19 other people. And there was very little for him to do each day. And I had to travel up the highway from Richmond Hill to visit him. So, we want to have supportive housing in our own community so that we can basically support our loved ones. My son now lives in our supportive housing program, which is 1 kilometer away. So I can go and visit him, or he can come and visit me. So that's what families want. What people don't realize, and one of the barriers is that they don't realize that we, and I'm speaking for myself personally, we cannot live in the same house as our loved one with a serious mental illness indefinitely. It's very, very stressful. Even if they're compliant with medication, it is very stressful because there's very little for them to do at home. But people don't see this. I mean, we're invisible to the public, the stress that families go through. So these are some of the challenges that families face, is sort of that not recognizing or knowing the difficulties of our lives and the fact that there's no supportive housing.
What other systems need to be involved to provide wraparound supports and services?
At Home on the Hill, we employ recreation therapists, we employ art therapists, we supply vocational counseling and counseling. When you have a psychotic illness, you really need to be engaged a lot of the time. It's a way of keeping you distracted from obsessive thinking or moods that, that spring. Sometimes a mood can change very quickly. So to help the person, it's really important that they're engaged in meaningful activity. My son actually now, his self-esteem has risen to the point where he's working part-time in a permanent position. We see supportive housing actually as a conduit to opportunities in the future.
So Surjit, I wanted to continue with you on the topic of the importance of ensuring that models are adopted and responsive to the needs. Could you tell us more about Anand Vihar, the Center for Dignified Living, and the housing model, and why you use this model?
Well, we are looking to provide affordable rental residence to vulnerable, low-income earning seniors, the disabled, their caregivers, as well. As you just heard Kathy, thinking that sometimes parents cannot be beside the loved ones and may want to be. So our solution is really an over-encompassing one, that the caregivers or the parents or brother, sister who look after the disabled can also have an opportunity to live together with them in an apartment in our facility so we are looking at a holistic care of not only the residents, but at the same time taking care of the community outside. So everybody talks about what is happening within. We are talking about not only within, but we open out to the surrounding community and saying, how do we engage not only the residents amongst themselves, but the residents with the community surrounding, so that there can be a healthy exchange of activities between the two, okay? At the same time, helping each other, learning from what they call is a co-housing, co-living type of an environment where people help each other. So really making sure that not only are you healthy, but your model is such that you are making the environment around you so vibrant and so helpful that everybody is being helped along to live comfortably well, longer into age, and never be bored, isolated, or feeling lonely. So that is our objective.
Wonderful. I really wanted to pick up on something you said there that I thought was just so amazing, the holistic piece. I think sometimes, when we talk about holistic support, we don't even mention sometimes that outside support of the community and making sure that folks have that connection. Was there any other pieces you wanted to add about your work or anything that you wanted to touch on?
Well, the thing is that see, we are approaching this whole situation in a person-centered care. So really enhancing the life of the person, not only of the disabled, but of his or her family. So we are looking at, first of all, it's the person, and you see the systems around it. And because our model includes seniors as well, so we are looking at providing something called a medical clinic, which will specialize in geriatric care. So they are going to be helping the seniors. At the same time, we look at the seniors as well as the persons with disabilities interacting in the community and in the residence together, doing things together. So it's like, you give a disabled person, it's like you have a mentor in the senior person who is living in the same facility, and they do things together. They do arts together, they do gardening together, they become like partners, and one is teaching the other. And it's not necessarily that the senior is teaching the junior, it could be the disabled teaching the senior. So it's like a combination of things happening where we are looking at enhancing the life of both. In our community, when you get to be a senior, you start, and the community says, wow, we got to look after you, we got to give you affordable housing. But we are only talking of giving you affordable housing. What happens to you when you are in it? I mean, we are saying, you come with us and we will involve you. Like I was surprised that at an interaction with a group of seniors, and I said, we're thinking of growing a vegetable garden, or we're thinking, as a matter of fact, we are thinking down the road, we'll have a vertical farm on the top of our residence. And a person got up, she says, I'm a botanist by trade. I would love to work in your facility. Please tell me when you're going to do it. So, there are, and I tell you, I recently, Janine, you would like to know about this. I recently contacted a famous writer, a botanist and a biochemist. It's Dr. Diana Beresford Kroger. She lives outside of Ottawa. And she is a specialist in climate change, and as a matter of fact, recommending what type of trees will regenerate our environment back to healthful effects on the community. And she has sent me a list of 5 trees that I could grow around in what we would call as a health garden around it, where you just sort of sit down on a bench and you get showered with these aerosols that come in the summer on you, and you feel calm. And as a matter of fact, people with disabilities and seniors would love an environment like that. So this is some of the things, Janine, we are thinking of. But while we are dreaming, the unfortunate part is that the community organizers or the government or the politicians are not really paying attention as to what we can provide them as solutions. They just have to ask us and provide us with the resources. And the starting point is, give me the land.
I definitely hear what you're saying. And you raised so many important points there, from, giving that explanation of all the wonderful work that you're doing. It's definitely really transformative in nature and touches on so many different things that, would really make some really big change. So That's just fantastic. And I think that last piece that you mentioned there about, making sure that government really understands what's needed and being able to have those conversations. I'd love to know from both of you, and Surjit, you can feel free to start, or Kathy, what are some ways that we can really work towards, making these changes and making sure that these changes are heard?
Well, I feel it's the interaction with people like yourself. Like, you spread the word, because we want people to know that the disabled and seniors represent over 40% of the population. 1 in 5 in Canada is disabled for various reasons. Does that mean they do not get the respect? This Canada means respect for all, including the disabled. The disabled get ignored. Right now, if you look at it, in Canada, everybody is talking about the seniors, but they represent 20% of the population. What about the disabled? Nobody talks about them, because perhaps, they are the people who are not getting the attention that they need, but they are there silently waiting for somebody to look after. They cannot speak for themselves. Does that mean they do not have a voice? So I am a guy who's speaking on their behalf, and I want to make sure. And I said, I had a meeting with the Markham Council yesterday, and I said, you know what, Mr. Mayor, I refuse to age. I cannot get old because I have to look after my son. I am a senior, but I cannot be a senior till my son is looked after. And my son is looked after. I will not die till my son is looked after. I cannot be old. I may look old, but I am younger than you. So we got to take care of each other. We got to depend on each other. We got to make sure that everybody deserves equal respect in this country. We have the best country in the world. Let's make it like that, just like that. I'm sorry, I'm being emotional here.
You're really passionate about it, and that's what we need to hear. Kathy, did you want to weigh in?
Yeah, I totally agree with you, Surjit. I'm a parent, and you basically expressed how we all feel. We can't die. What's going to happen to my son after I die? That's what we're all thinking. And I think a question, Janine, was how do we create change? Well, we create change by taking part in a podcast like this, discussing these problems, as Surjit did, going to council in Markham and expressing his feelings. I believe that change will come from the ground up. I really, I find locally our municipal government has improved, and I find that they pay more attention to the needs of their community than the provincial government does, or the federal government. And I think, as I said before, change comes from the bottom up. My neighbors care about me. I've had so many crisis vehicles come to my house. You'd think that, as one neighbor, only one neighbor said, maybe our real estate prices are going to go down because of all the activity at my house. But generally, the neighborhood has been so supportive of me, because they know that my son is in crisis because there's such a lack of services. They know this. We really need to communicate that to the upper ups. But change begins at the bottom. It's in the court of public opinion that we're going to get change. And, it's podcasts like this that make a difference.
Thanks, Kathy. Wonderful. Was there anything else that you wanted to weigh in on there, Surjit?
Well, all I can say is that our idea is to have a happy community. A happy community being that we work on the principle of mutual inclusion, meaning the old, the middle, all of them come together as a community with respect for each other, and not speaking to terms like not in my backyard. We are looking at every human being as a human who is deserving of equal respect, who lives in harmony and thrives with dignity in the environment that he or she lives. So my objective is to create small communities, or give the message across, to have small communities where people sort of, celebrate together, where they have festivals together, where they have food together, where they will celebrate each other. Of course, we know eventually we're going to all die, but let's have a healthy life leading towards. They say if you look after yourself, if you lead a good life, then you will have a good ending also. So my objective is to make sure that my son, he's my only child, Janine. So I want to make sure that when I pass away, that he's in good hands. And I will not stop. I will not stop till the government or the agencies come around to help, because I am doing my part, but they have to do their part. It is a partnership between humans. We, as human beings, must make sure that the seniors, as well as the people with disabilities, are looked after the same way. Right now, everybody's talking about housing for seniors, but just a little beside it, you should say housing for seniors and the disabled as well, and the young families that are not doing so well financially. Maybe we should be sort of, it's not, there are people who are healthy and hearty and everything. They don't have the economic means. Well, let's provide them with dignity. Let's give them affordable housing. So all of us together as humans, celebrate the beautiful Canada that we live in. I love my country. Thank you.
I just want to add in here that I've noticed that there is a change in feeling about inclusiveness, and now just very recently our council in Richmond Hill has declared Richmond Hill a community of compassion, a compassionate community. And that's very recent, because I remember some months ago I did a deputation to our Richmond Hill Council to support the affordable housing strategy, which included supportive housing. And afterwards, I was very disappointed to hear the chair of that the chair of the council say, "Oh well, supportive housing belongs to Housing York. We're talking about affordable housing. We're not talking about housing for people with disabilities. That belongs to Housing York." Well, I really got ticked off at that, So I wrote a letter to the Liberal, and it got published. And I said that we here, we're a community. We belong. It's not us and them. It's us. And Surjit, I respect you so much, for basically saying what we parents need to say. Our kids belong, and they belong in our home community.
Thanks so much, Surjit and Kathy, for joining us today. It was so great to hear about the amazing work that you do, to hear the passion, to hear the suggestions, and really hear from both of you, how much we need to really invest in these issues and invest in the care that's needed. So I really thank you for your time today and for sharing this with our listeners. Family caregivers increasingly shoulder the responsibility of primary caregiving to their loved ones with serious mental illness. 50 to 90% of people with mental illness live with their families, but with an aging population, this is simply not sustainable. The stress is too much for the caregiver, and their own health is often affected. Housing models like Home on the Hill and Anand Vihar Intentional Living Consortium provide a cost-effective and human response to the challenge of providing housing for vulnerable and marginalized populations, one where residents can contribute to the community and find meaning in their lives. Season 3 of Hidden Stories of York Region was written and produced as a collaboration between the Social Planning Council of York Region and Aurora Public Library. Hidden Stories of York Region is available on Spotify, Apple Podcasts, and on the social media platforms of the Social Planning Council of York Region and Aurora Public Library. If you enjoyed this episode, like us, share with others, and be part of the change.